Give us a sense of where we are right now. We heard from Governor Cuomo today, third day of apparently plateauing in new infections, although the death rate did go up. Where do you think we are?
Well, that's exactly right. And you look at trends, certainly one day does not make a trend, but over 3 days we've seen the rate of hospitalization go down. And that is something we've been looking forward to for a while because although the death rate has gone up and it's horrific to know that we lost 731 people in the last 24 hours, what that says to us is some of these people may have been in the hospital on ventilators for some time. And if we have fewer people entering the hospital system, fewer going into the ICUs, that this could be a break that we've been looking for, but it is far too early for us to change anything we've been doing because we believe that the social distancing that we've put in place aggressively in New York is the reason that these numbers aren't dramatically higher.
That seems to be a broad consensus, actually, among public health officials. Do we have any sense of whether people may be starting to back off the social distancing as they hear it's plateaued if it hasn't gone down?
Well, plateauing at a high level is not something to give a high five over. I mean, these are still very high numbers of people that are testing positive. We have 138,000 people, up from 130,000. So I don't think anyone should let down their guard or become complacent because we'll actually end up right back where we started and have to institute all these measures once again and delay our recovery, which is something we're all so anxious to get started. So anyone who thinks that plateauing at a high level is declaring success is wrong, and they're not listening to the governor and myself as we sound the alarm that as the weather gets nice and we're approaching the holiday season, the Passover, the Seders, Easter Sunday next weekend, there will be tremendous temptation to say, well, we haven't seen Grandma in a month. Let's go visit our family. Don't do it. Don't take our foot off the pedal as we're heading into the final stretch here because this is what is saving us. And if we back off now, this will all have been in vain.
Lieutenant Governor Hochul, give us a sense of how the healthcare system is holding up. The hospitals, by all accounts, are at or even beyond their maximum capacity. How long can they keep up this pace?
Well, this has been a problem. The governor has addressed it in three dynamics here. One is how many hospital beds, and we went from 53,000 hospital beds when this crisis started to, because of the governor's aggressive efforts to increase capacity and get assistance from the federal government, we now have 90,000 beds available. But those beds don't mean anything if you don't have enough staff and supplies. On the staffing front, as predicted, our superhero frontline individuals who are in there taking care of the sick and people in the ICUs in particular, they are also succumbing. Many of them are becoming ill, and they've been away from their families for a long time, and there's a probably high burnout, but they keep going at it once and again and again and again. But now we have a reserve of 7,000 people who've been hired from the incredible outpouring of volunteers from all over this country. 7,000 people have been hired by hospitals recently because they stepped up. Many of them had been retired and people from all over America. So we feel good about that part. The supplies, the governor would say that we have no hospital is going for a ventilator, which is so important, but that's also a concern of ours because any spike in a particular region could require even a higher intense number of ventilators. Look at what's happening in Suffolk County, for example, on Long Island or Nassau County. They need ventilators more than they did even a week ago, and so we're constantly redeploying resources to make sure that the hospitals can handle the surge in their area and leaving no area unprotected. That's been our goal all along.
So, Lieutenant Governor Hochul, we hope at or nearing at least the apex, and so we're very much in the crisis, and we don't know, as Governor Cuomo said, what's on the other side of that. And so we don't want to get ahead of ourselves, as you said. We don't want to encourage people to really go out and do away with social distancing. But it's not too soon for the government to start thinking about when and how we even think about starting to get back to work. Are you working on what that plan looks like? Obviously, we're not going to just let everybody go. It has to be staged. Is there a plan being developed for New York?
Absolutely. And what the governor and I agree with is that it also comes down to testing. We don't want to declare that it's safe for people to go back to work unless we can test and find out. Certainly the first wave of people would be people who've already had the coronavirus and overcame it and are now healthy again, and people who've developed the antibodies. But we're only going to know for sure if we can have widespread testing, which, because of a number of issues with the federal government early on and a lack of testing capacity, as well as just the basic supplies, the swabs you need, the reagents you need. We've had a shortage of those, but if we can get the federal government to ramp up production of these necessary supplies so we can have rapid testing, I mean, there are opportunities for us to have a result literally in a doctor's office in 5 minutes, 15 minutes, a half an hour, depending on the type of materials used. But we have to get to that point in order for us to feel confident that we're just not having a downward trend that's going to spike up again, as has happened when we study past pandemics, certainly the 1918 Spanish flu. We don't want to end up with a 6-month phenomenon, which is what happened there, and we lost 60,000 New Yorkers. We have been very proactive in preventing that scenario because of the steps Governor Cuomo has taken, and other states are following our lead, and we're proud of that. But we also have to talk about what it's going to take to get individual industries back. But in addition to that, David, I have been focused as chair of all the state regional economic development councils overseeing economic development. I've already been in contact with the statewide chambers of commerce, regional representatives from the industries, manufacturing, and others, talking about how we jumpstart the economy once we start going full steam ahead. Because there'll be a lot of businesses, a lot of small businesses in particular, that just may not make it. If they can't get the assistance they need from the federal government, they need a lifeline now, or they're gone forever. And all the work that we've done in the state to reduce unemployment, to increase jobs, to have more investments in economic development, we don't want to lose where we've gone. So I'm already thinking about that and having the conversations literally as we speak.
Yeah. Right. Critically important. One last question, specifically on testing. Do you have a sense of how far we are away in terms of time to have the required testing to really make the move to start opening up?
No, we just don't have the capacity yet. And if we could get the federal government to invoke the Defense Production Act and have widespread testing materials created, we'd be in a much better place. So the governor has, in the absence of that action being taken, the governor is working with the governors of our regional, our tri-state area, New Jersey and Connecticut, to talk about incentivizing businesses to really ramp up production, because these three states are really interconnected. I mean, they're all basically suburbs of each other, and New York is at the epicenter of all that. And so it doesn't even matter for us in New York City to say we have a policy, but if workers are coming in from Connecticut who haven't been tested or coming in from New Jersey, then we're not going to get ahead of this. So we're not there yet, but we know what we need to do to get to that place.